Have you ever wondered why type 1 diabetes is often referred to as a silent killer? It's a question that triggers curiosity and concern, isn't it? Well, the term silent killer is used because this form of diabetes often goes unnoticed until it starts causing serious health complications. It's like that covert agent working under the radar, quietly disrupting the body's normal functioning. Type 1 diabetes, also known as juvenile diabetes, is a chronic condition in which the pancreas produces little or no insulin, a hormone needed to allow sugar to enter cells to produce energy. It's a complex condition that affects millions of people worldwide, across age groups. In this video, we're going to delve into the world of type 1 diabetes. We'll explore its mysterious origin, the telltale signs that may help in early detection, and the available treatment options to manage it effectively. You might be surprised by what you learn. Stick around to learn more about this complex condition, its causes, symptoms, and treatments. Type 1 diabetes, unlike type 2, is not a lifestyle disease, but what exactly is it? Let's shed some light on this. In essence, type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas, leaving the body unable to produce insulin. Without insulin, our body can't regulate the amount of glucose in our blood. This sugar buildup can lead to serious health problems, even life-threatening ones. Unlike type 2 diabetes, where lifestyle choices like diet and exercise can play a significant role, type 1 diabetes is not preventable. It can strike at any age, though it's often diagnosed in children and young adults. So how does it differ from type 2 diabetes? Well, while both types result in high blood sugar levels, the cause and management differ significantly. Type 2 is often linked to obesity and inactivity, while type 1 is not. With type 1 diabetes, the body wages a war against itself, but what triggers this battle? The exact cause of type 1 diabetes remains unknown, but there are theories. Want to hear about them? Let's delve right in. One widely accepted theory is that of genetic predisposition. Diabetes tends to run in families, suggesting a hereditary factor. Certain genes can make people more susceptible to developing type 1 diabetes. However, genes are just part of the story. Environmental factors also come into play. Some scientists believe that exposure to certain viruses like the Coxsackie virus may trigger an autoimmune response leading to type 1 diabetes. This happens when the immune system mistakenly destroys insulin-producing cells in the pancreas, mistaking them for invaders. Other potential triggers could include dietary factors in early childhood, or even exposure to certain toxins. So, while the exact cause remains elusive, it's clear that both nature and nurture likely play a role in the development of type 1 diabetes. Understanding the causes is one thing, but recognizing the symptoms is another. Type 1 diabetes can often go undiagnosed. Do you know what symptoms to look out for? Let's delve into the most common signs that may indicate this condition. First off, an increased thirst that seems to persist, no matter how much water you drink. This is due to excessive sugar building up in your bloodstream, causing your body to extract fluid from tissues. Hence, the unquenchable thirst. Secondly, you might notice a surge in the frequency of urination. It's a direct result of your body trying to get rid of the excess sugar by flushing it out through urine. Moving on, unexplained weight loss is another symptom. Despite eating more than usual to relieve hunger, you may still lose weight. This happens because the glucose your cells need for energy is excreted through urine instead. Lastly, fatigue. This is because your body's cells are unable to obtain sugar for energy, leaving you feeling tired and irritable. Recognizing these symptoms can lead to early diagnosis and treatment. Speaking of which, there's no cure for type 1 diabetes, but it can be managed. How, you ask? First and foremost, insulin therapy is the cornerstone of treatment. This involves injecting insulin under the skin or wearing an insulin pump to replace the insulin your body is not making. Next, it's important to monitor blood sugar levels regularly. This helps you adjust your insulin dosage and diet to keep your blood sugar within a target range. Some people might use continuous glucose monitors that provide real-time blood sugar readings. And of course, maintaining a healthy lifestyle is crucial. Eating a balanced diet, getting regular exercise, and keeping a consistent sleep schedule can all contribute to better blood sugar control. One final note, mental health matters too. Living with type 1 diabetes can be stressful, so don't hesitate to seek support from healthcare professionals, friends, or support groups. Remember, while type 1 diabetes is a lifelong condition, it doesn't have to define your life.